Hi, this is Sarah of Spine Wellness Mexicaribe, and I'm here today with the exciting webinar of Trifecta Full Body Light Bed. And we have Dr. Carl Rothschild here with us today. How are you, Dr. Carl?
I'm great. I'm loving the opportunity to talk to people about something that has played a very important role in my life for many years.
Excellent. Well, I'm a huge fan of red light therapy, and we're excited to learn a little bit more about your technology and what sets it apart from the rest. I'm going to hand over to you.
All right. Well, thank you so much. Let me start off with I'm going to actually give you guys an opportunity to see the screen. So is everybody seeing that screen now?
We are seeing it, yes.
Beautiful. So let me tell you that it all started in 1978 when I became a chiropractor. So I've been a chiropractor for 48 years, and about 20 years into my practice, I was introduced to red light therapy when really nobody else was doing it, or very few people were doing it. And it revolutionized my practice. I was able to heal and do things that was unbelievable. And again, I want to point out that that equipment that I was using that many years ago was a tiny fraction of the power that we currently have. So over the years, we've developed more powerful devices, but then something happened called COVID. And our practitioners wanted something that would allow the patient to get in the bed without their assistance. And we created the bed. Up until that point, we were using lasers and pads and things like that. We created the bed only as a substitute, not realizing what we subsequently have learned is that when you bathe the whole body at the same time, top to bottom, left to right, front and back, and inside and out, affecting as many cells in the body as possible, that's when the miracles happen. And we're going to talk about a few of the miracles. You're not going to believe what I'm going to tell you. And I know some of you have toyed around with red light therapy. I don't object to people having a face mask or a helmet, but the miracles, the full body experience is what it takes for the miracles. And when I talk about miracles, I'm talking about what we call the fountain of youth. I know it sounds corny, but it is. And we're going to talk more about that in a moment. About myself, I started, as I said, in 1978. So I have to update this. It's more than 46 years. I started in light therapy about 27 years ago. And I started manufacturing about 12, 13 years ago. And the reason we started manufacturing is about then is when we learned that there was an element of red light that could actually shrink fat cells. And if you don't know that, in many countries, weight loss is a big deal. And imagine if you can use something healthy. We're not killing anything off. We're not injuring anything. We're not putting anything in the body that doesn't belong there, yanking anything out. We're using a natural process to lose fat. That's when I decided I'm going to get into this even in a bigger way. And I started manufacturing. So we call it now, as I'm going to be describing, and I think you're going to agree to this, that we call it the photomedicine revolution. So there are things that we're able to heal that you are not, again, going to believe. And I have some videos here. And if you could think of any condition, anything later on, if you want to ask questions, I don't care what you have. There's a very strong likelihood that we'll be able to assist you, whether it's Parkinson's, dementia, Alzheimer's, multiple sclerosis, whether it's any autoimmune disease, whether it's kidney issues, diabetes, and I could just go on. But of course, any musculoskeletal problem. So we're talking about any bone or joint or tissues or ligaments and muscle, whatever. The results with that are quite spectacular. And I can go on, but I'm not going to bore you with everything unless you have questions about that. And another thing that they call it is disruptive medicine. In the world of medicine, money talks. You just need to know that not every doctor out there is just there for your well-being, but he's also interested in making a living. I don't mind that. I don't blame them. But we're calling this disruptive medicine, where the amount of surgeries and amount of drug use can drop dramatically if people would start using red light therapy even more. I do want to introduce you to our website, which is trifectalight.com. A lot of great information there. And one of the things I want you to do is to go to go to the Contact Us page on the website, trifectalight.com. And on that Contact Us page, on the left side of that, If you're in the United States, you can access some of the locations. We don't have that many south of the border yet, and that's where you guys are going to come in and help us develop and send these beds out to many people throughout the whole world, actually. So at any rate, but when you go to that website, go to the contact us page, you can also ask any kind of question, access our information. I'll show you one of my key assistants whose name is Brigitte, and she'll be your contact person if you have any questions, any issues, if you want to find out how to actually get something like this in your community. I did want to mention that, interestingly enough, if somebody gets in our bed and they are perfect, if that's possible, they don't have any ailments, they don't have any issues, I don't know if they're going to see a difference. They probably will. But the interesting thing is the more extreme somebody's condition is, the more dramatic the results are. So the worse off you are, the messier you are, the more interesting the results can be. So some of the things that your clients might expect, if you have patients and stuff, besides what they came in for, across the board, people are talking about more energy, more clarity, better sleep. The people are talking about sleeping like a baby, they describe it, better digestion. The skin's going to look fantastic, fine lines and wrinkles. And remember, this is all natural, nothing damaging or injuring. You're not putting anything in the body that doesn't belong there. Skin's going to look great. The person is going to experience this word called joy like they haven't experienced in a while, especially highly depressed people. I had this one lady that wrote me an email, and she said, if this is how normal people feel every day, I can't believe I've been missing out, because she was so highly depressed, hated her life. And after 2 weeks of treatment with the bed, she experienced this word, as I said, the word joy. She hadn't experienced it in a long, long time. And she was so grateful. And she's been in touch with us regularly as we witness some of the other successes that she's had. The other thing is that the eyes. So when a person gets in our bed, they just keep their eyes closed. We don't have them wear the goggles. And the reason is because you want this incredible, wonderful energy in the eye, in the mouth. So the person keeps their mouth open and their eyes closed. They can open their eyes, but it's a very bright light, so it's annoying. So they just keep their eyes closed. If you're wondering if the light can get through the eyelid, it can get through the skull and get to the brain, so you know it can get to the eyelid. And now talk about anything in the eyes that you can think of, including macular degeneration and macular edema, including floaters and cataracts and glaucoma and uveitis. I'm going to play a video for you of a lady that had uveitis and listen to the changes in her life. Amazing. And then the thing, as I said, that stimulated my wanting to get into manufacturing was the fact that there is an element of light that can actually assist in weight loss. I'm not going to go into a lot of detail, but we will explain briefly what the mechanism with that is. So I had a lady, her name is Jessica, and she wrote this letter to me. Words cannot describe what red light has done for me. I had Lyme disease several years ago, and it completely ravaged me. It ran through every single body system, from gastric to endocrine to cardiovascular and everything in between. I never thought I would heal from Lyme, and red light did just that. So I'm going to play this video. I have lots of videos I'm not going to play, but I'm going to send through a show notes. We'll send you all the videos and a lot of other connections there. But when I called her, I thought I was just going to talk to her about Lyme disease. But I couldn't believe it. She was talking about so many different ailments. Imagine that this woman spent much of her day concerned with doctor visits, drugs that she had to take, or pills that she had to take, and injections that she had to get. So this is just 3 minutes, if you don't mind. Just take a listen to this.
I do suffer from 3 forms of psoriasis. I have plaque psoriasis, guttate psoriasis, and psoriatic arthritis. Prior to using red light therapy, the plaque psoriasis, you could literally see it all here on my head, my scalp. Both ears were constantly red and bleeding. You could see it all here, both arms all the way down. And as you can see, there's nothing there. It was literally all over my body.
How long did you suffer with that?
I have suffered with that for over 2 decades. So I was kind of at my wit's end and started using red light therapy. And you can just see such a huge difference on my skin, my hands, everywhere. I would frequently wake up and have dactylitis in my toes where they were so swollen. They looked like little sausages and they were black and blue. Red light therapy has cleared that up. In 2 treatments, the toes were completely healed. The extreme fatigue, brain fog, floaters in the eyes. It has affected my eyes. I have seen a specialist because the uveitis has been so bad. Pressure on this eye from the inflammation and swelling was 180.
And now what is it?
It's normal. I am a kidney stone maker because of a medicine that I was on for migraines. After hundreds and hundreds of kidney stones, I feel that pain and know that pain. I will do a red light session. So not only does it alleviate the pain, but I know, within a day, sometimes within hours, I'm going to easily pass that stone.
Again, I just want to also reiterate, were you getting injections in your eye?
Yes.
We mentioned that. And what would that be like?
Oh, it was horrible. Seeing that needle coming through the eye, it's really, really anxiety inducing. I know that I can take care of this with red light and avoid having to go to the retina specialist, avoid the expensive, drops and the shots. I have not used the drops since.
So you're probably at that point, you were at $400 a month just for the drops.
Yes. Since starting the red light, I have not had to see the rheumatologist. I have not had to go back to the cardiologist. My thyroid is wonderful. I feel that wave of comfort and that wave of just peace. The bed for me is my go-to because, especially having an autoimmune like psoriatic arthritis and things that affect my entire body, I like to be able to lay and have everything exposed in the bed. So I love the bed. It's just something that has really changed my life and saved my life.
And this is the kind of thing that we hear more than ever. As a chiropractor, as a practitioner, I went into business. I went into that to help as many people as I could. And can you imagine how rewarding it feels when a patient looks you in the eye and says, and I want to thank you for giving me my life back. I love it. And you're going to hear this more than you've ever heard before. Now, you don't have to be a health practitioner. This is the whole beauty industry, fitness industry, weight loss industry, and of course, yes, healing as well. So with that, moving right along, and again, as I mentioned, I believe before, it's not about putting anything in the body that doesn't belong there or yanking anything out that does. It's about bringing the body back to normal. So why did we call it the trifecta? We started off, one of our associates said it was like winning the trifecta at a racetrack. So it's the triple effect of face, fat, and healing. And really, in regards to face, it's really skin from head to toe. But we emphasize the face because the face, and I'm going to show you a couple of pictures about before and afters with the face, and they're fantastic. But there are other divisions to the company, including men's health, women's health, athletes, and mental health. So let me talk to you about athletes. If you know a serious athlete, or you yourself are a serious athlete, if you get in our bed before your activity or your workout or your game or whatever it is, you're going to perform much better, much better. In fact, I had a guy call me up and said what he couldn't believe is that, and he's a very serious swimmer, and he can now swim almost twice the distance he used to be able to swim because of using this type of therapy. So yeah, that's the kind of thing that we're hearing of athletes. And it's the reason why we're with the professional athletes in the United States, why we're with the Olympic training centers, why we're with other athletic facilities, again, because they get in the bed before their activity and they'll perform much better, but they also get in the bed after their activity to more fully and quick and faster recovery. For faster recovery, I mean, it's amazing the kind of results that we'll get. So it kind of frustrates me. And if you have a serious athlete that you know of, I'm here in Los Angeles. So when I see a player on let's say the Los Angeles Dodgers, for example, who I know is sidelined because he's got an injury that nobody's helping with the type of therapies, I know that if he was using our bed, we would heal that so much faster. All right. So how does it work? There are two completely separate mechanisms. I'm not going to spend a lot of time on this. When you buy one of our piece of equipment, we include 32 things with that purchase. And one of those things is the advanced, well, there's the basic training, and then the advanced training is one-on-one with me. And it's all done online, so you don't have to come get on a plane and come visit me in Los Angeles. But there are two completely separate mechanisms. One of those mechanisms is fat loss. And that's only been discovered over the last, let's say, 15 years. Prior to that, they were just doing more research on everything else. That's the healing, hair restoration, and you can work your finger all the way down your body and everything in between, and you'll see almost any condition out there that you can have tremendous assistance with. So with the fat loss, it comes down to this. The red light temporarily makes the fat cell walls more porous. Again, in the beginning, they didn't know why and how it worked, but now they do. This allows some of the contents to escape into the surrounding tissue. And with our special protocol, we move the fat through the lymphatic system, eventually to the liver for use or elimination. Again, it's all clean, very simple. Nothing's being damaged. All we're doing is moving the fat out of the fat cells, some of the fat out of the fat cells, and eventually to the liver. And the cells return to absolute normal. So you're not making any permanent changes. The fat cell wall only becomes more porous for just a short period of time. Now there's the everything else. This is what I'm in love with. I'm a healer. And what they've discovered is that this other element of the lights has to do with the healing sun. What we've done is we've taken 4 elements of sunlight, none of the UV light, nothing that could be damaging. There are never, in fact, in the 50 years we've studied this technology, there's never been a recorded side effect. You could not hurt somebody even if you tried. So with the healing sun, we've taken 4 elements of sunlight, 4 wavelengths of sunlight in the red and near infrared zone. We've magnified them many, many, many times and then drive it deep into the person's body. What the essence is this word called mitochondria. So you know your body is made up of tissues, and every tissue is made up of cells, and every cell has a series of components within it. And one of those is called the mitochondria, and they hold the key to health and longevity. Their main function is to generate large amounts of energy that's required to power everything in your body and anything that happens in your body. So you want fully happy, functioning mitochondria. You know, we call the mitochondria the powerhouse of the cell. They're the reason we breathe oxygen and eat food, to generate this very important molecule called ATP. The ATP, if you have the right amount of ATP, which is the energy currency of the body, it's the reason, you know, that you'll function better. You need this ATP. If you have an inferior amount of ATP, you're going to suffer. It'll lead to eventually disease and death. And in fact, there are scientists out there that were under the incorrect idea that eventually, as you get older, the mitochondria will definitely dysfunction or not function as well. And they're not right. If you can clean your act up, meaning staying away from the things that we already know that are damaging you, example of smoking, but just for an example, but there are many other things that people, or some other things that people do to damage their body. If you can get away from doing that and use red light therapy to bring your mitochondria back to well-being and health, the results are spectacular, like you heard with Jessica just a moment ago, but we have many testimonials of this kind of thing. So again, the mitochondria are the reason why we breathe oxygen and eat food, to generate that very important ATP. But what people didn't realize until more recently is that the mitochondria, when I went to school, I was taught that there's one mitochondria in every cell of the body. That's not true. In fact, some of the cells, like your heart cells, which have a huge demand on energy, have over 5,000 mitochondria in each one of those cells. So much so that the mitochondria makes up 10% of your body weight. Now, I want that to sink in. Comparing that to the 10% of your body weight for mitochondria, when you think about bone and hair and skin and blood and all those other things, and yet and still the mitochondria makes up 10% of your body weight, to give you an idea how prevalent they are, how important they are, and how what we want to do is to make sure your mitochondria is functioning at top gear, so to speak. And so our red and near infrared light stimulate the mitochondria of every exposed cell in the body to come back to normal. And that's why a full body exposure is critical for this type of thing. If you just want to help your elbow, okay, you want to just put a pad over it, fine. As a holistic doctor, I don't even believe in that, because I believe that I want to make sure that I get perfect blood flow to that area, perfect nerve flow to that area. So it's a whole body experience. And I've treated people for 48 years that way, whole body. So my staff put together the most common conditions that we have seen people have great results with, including autoimmune disease. This was one gentleman in particular had Charcot-Marie tooth disease. That guaranteed him 15 years of pain, lots of pain, and he couldn't walk for 15 years. And after 6 visits on the red light bed, now I want to point out that the treatment is just 12 minutes long. And so 6 visits means 3 times a week for 2 weeks. At the end of the 6th visit, he's one of the first ones to have said to the camera, "Thank you for giving me my life back," because he was one of the first ones we interviewed after we started sending out beds to people. And after those 6 visits, he's walking, he's on treadmill, he's walking his dog for the first time ever. He's having the time of his life, so to speak. Now imagine a guy calls you up and says, "Hey, I'm having a heart attack as often as twice a week. Can you help me?" What would you do? Nobody has an answer for this. The medical profession, what they did is they implanted a defibrillator in his chest something like 13 years ago. So every time he died, it would zap him back to life. But he was dying. By the time we met him, when it started, it was once a month heart attack. By the time we met him, it was as often as once or twice a week. So I'm going to play this 1 minute long video. I mean, this is startling. I also want you to look at his face. Now, when we saw him earlier on, his face had little black moles on it, raised moles, not a lot, but some. And they see how clean his skin is. No one noticed that, but one of our staff members noticed that. So we weren't thinking about that because this guy was having regular heart attacks, and that was more important to everybody. But take a listen to this.
I've been living with congestive heart failure for the last 12 years. I was experiencing my heart stopping about once a week.
And my understanding is since you've been on the bed, that hasn't occurred anymore. Is that correct?
That is absolutely correct. Since I've started the treatment, I haven't had any more heart attacks. The other benefit that I've got that I wasn't looking for, I'm up to the point to where my energy level is through the roof. I've been taking my blood pressure and monitoring it, and it has literally normalized my blood pressure. The other biggest issue I was having, besides the heart attacks, was erectile dysfunction. That was the first sign that there was something to this red light bed, much to my surprise and my wife's joy. To be honest with you, Dr. Carl, anybody that'll stand still long enough for me to get my spill out, I'm telling them about this bed. Just get on the bed. Last Sunday at church, one of my church members, and I'm getting chill bumps as I tell you this, she looked me in my eyes and she said, "You found life again. Something has changed inside of you." And I told her, "Yep, red light therapy."
Now, I want to tell you something. When you're building a business, and I've had 12 practices, I know how to build a business, market, manage, and whatever. And one of the things you need to learn is that it's not satisfied people that refer. It's excited patients that refer. And someone like this who's coming to your office after these kind of results, it's not uncommon that they'll refer 20 people to your office. I just spoke to this lady. She had terrible back problems and knee problems, and now she doesn't. And so she referred 18 people to the office where she goes. So our practitioners are having the time of their life. Not only is this the easiest thing, imagine in chiropractic, some of the techniques that we have to learn could take years to learn. Now, let me tell you how difficult it is to use the bed. You see this finger? That's all that's required. The patient pushes the on button, gets in the bed. When it's over, they get out of the bed, they leave, They go up to the front desk and they wave goodbye because they've already paid in advance and they've already scheduled in advance. I've never experienced anything with such a level of success that is so darn easy. So at any rate, you can imagine that Arnett was very excited, so much so that he convinced people to buy a bed in his area for the business so that he could use it more often, because he had to travel quite a distance to the office that he was using up to that point. So we've also had great results with Crohn's disease. In fact, Jessica, that we listened to her video before, she had over 20 years of constant diarrhea. And now she has normal bowel movements. Dementia. So we had one lady, her mother had such severe Parkinson's and dementia that they weren't able to deal with her at home anymore. And so what they decided they were going to have to find a home for her because she was belligerent and she was a danger to herself and others. But they decided to give this red light bed one last, the bed one chance here. And getting this 85-year-old woman with severe Parkinson's and dementia into the bed was a big challenge. And the reason is because if you've seen someone with advanced Parkinson's, they're like a stone. They're so rigid. They got her in, and after just that one visit, getting her out of the bed was much easier. And after 2 weeks, her dementia was much more mild. She was actually able to communicate. She was lucid. And her Parkinson's, you're not going to get rid of the Parkinson's, but her Parkinson's was so much more mild. And over the months that continued the treatment, what we're looking for with this 85-year-old lady, we're not going to find her running a marathon, but what we are looking for is that her quality of life is going to be way better. So great results with kidney. Now, the ones that are highlighted, we have testimonial videos on. Some of the others in between, we don't have, even though we have anecdotal evidence, we've got reports and I've spoken to them, but some people are shy and some people we just haven't arranged to get that testimonial video yet. We already talked about erectile dysfunction with Arnett, so I should probably highlight that in yellow. We talked about Lyme disease briefly with Jessica, but I'm going to send you guys a bunch of videos and stuff like that you can send to your audience. But with the Lyme disease, the results are incredible. So this one guy, he contracted Lyme when he was 12. It ruined his life. There were days when he wasn't sure that he can get out of bed or his activity was greatly reduced. So he couldn't have a career because he wasn't a great employee, to be honest with you, at that point. And then to listen to him, when you see his name is Steve, listen to this and listen and watch this video. It's one of those videos that's very striking. So I'll let you get that when you can. This is him, but I don't think we have the time to watch this right now. If we do, I'll come back to it later. We talked about Parkinson's, and this is the woman whose mother was in such bad shape. Then we talk about shingles, stroke. We had a lady, Jerisha, who had a stroke, and after 8 visits on the bed, she was better than before she ever had the stroke. And then, of course, any musculoskeletal issue. I don't care if it's bone, joint, muscles, tendons, ligament, doesn't matter. Results are spectacular. And nearly every skin condition, including severe acne, dermatitis, eczema, moles, psoriasis, sagging skin scars, skin tags, and stretch marks. So with the weight loss that we do, you're not going to see associated sagging skin or stretch marks because as the person is losing the fat, we're also tightening the skin at the same time. What I do want you to learn is about scholar.google.com. You go to Google Scholar. It looks a lot like Google, but it's a much more advanced version. And you put in the word photo biomodulation. That's what this whole technology is. Photo meaning light, bio meaning tissue, and modulation as well, it does something. And when you put that word in there, and then any condition after that, you're going to see hundreds, if not thousands, of articles, double-blind studies, research stuff, and things like that. And you'll learn a lot about how photobiomodulation is so successful. So what makes our bed so special is one, power. Now, power by itself is not a big deal. What's a big deal is a lot of power without heat. Heat is the limiting factor. If your equipment actually generates heat, The problem with heat is that it dilates blood vessels. It brings more blood to the surface that would block the penetration of the light. The last thing you want is heat. So with our bed, we can have a lot of power, but without heat. That's where the money is. That's where the technology is. That's where all the research has been done over all these years that I've been doing this for 28 years, studying it and trying to get lights that are very strong without the heat that would then block the penetration of our light. The other thing is coverage, as we already mentioned, head to toe coverage. That's a critical factor. And then the last thing is the ability to pulse the wave. And we call this frequency, where we're able to pulse the wave, as you will learn that pulsing the wave serves a couple of purposes. One, it allows for more power with even less heat because it dissipates the heat between each of the impulses. And then also this thing called resonating frequencies, which some of you don't know about. If you've heard about PEMF, there are all kinds of different ways of generating frequencies. One is vibration, one is sound, ours is with light, and the other thing is microcurrent, where someone's holding on to something and they're passing a current through your body to generate these frequencies. And it works. So that ability to create that pulsation with the lights has enhanced our results even better. So I just want to show you some quick results. This lady was on a really good diet, actually, and she really plateaued at this point, and she hated the way she looked. So, again, remember, the worst that'll happen with anybody is nothing. So you couldn't hurt anybody. So the approach that this owner of this equipment said in this location here, and I think it was in Arizona, she said, well, let's try it. So they did 6 weeks at 2 or 3 times a week, I believe. And after 6 weeks, it looked like that. Now, some of you are thinking, well, does that happen with everybody? It happens with a lot of people. And yes, this person was thrilled with the results and referred a ton of people to that facility. I like showing this picture because I'm going to show you how you're not going to generate sagging skin or stretch mark. And again, when I talked to the doctor's office, this was in Florida, this woman didn't change her diet according to the doctor at all. So she wasn't on a great diet. Now, I'm not happy about that. I want people to not think that they can go home and pig out every night, that they can then have great results. We're not asking them to starve themselves. We're asking them what we call get on a calorically neutral diet, a diet that will not increase their fat, won't decrease, just neutral. And then adding red light will make such a huge difference. So take a look after 6 weeks. You can see beautiful results. And she was thrilled, as the office was thrilled. Now, I talked to you about face fat and healing. Look at under the chin and jowl region. This is a 72-year-old lady that she's the one that sent me these pictures. She owned the facility, so she decided, hey, I might as well try it for myself. Again, look under the chin and jowl region, the fine lines and wrinkles. And this was, I write down 4 weeks. It was less than 4 weeks, but nobody believes it when I tell them how many visits. So let's just leave it at, let's say, a month. And look at these beautiful results under the chin and jowl region, the fine lines and wrinkles. And this would no, it wasn't Photoshopped. And we didn't take this picture. This lady took the picture and sent it to me. Now, I don't know if a lot of you guys want to do cellulite, but the results are spectacular. And again, most people think this is Photoshopped. It was not. Also, from the healing aspect, it's hard to show you ripped or torn tendons or ligaments, but it's easy to show you with a 3rd-degree burn. This lady was guaranteed by the wound center to have 6 months of pain, 6 months of drugs, and permanent scarring. And by the middle of the 2nd week, the pain was gone. And by the end of the 3rd week, it was gone. It was just a little red. Now, the reason why we don't have the final picture where it wouldn't even be red, which is the next week, is because this lady left town. We weren't able to get that final picture from her. And again, I already mentioned to you, it's not satisfied patients that refer. It's excited patients that refer. And you're never going to see more excited people than you will with this technology. And remember, I already talked to you about heat, but I want to reemphasize how important it is that your lights don't get hot. You want that, because heat draws blood to the surface and blocks the penetration of the light. So you want the very high-end medical grade lights that, again, are really strong without getting hot. So with the bed, it looks like a piece of artwork anyhow. I mean, it's beautiful. You'll see it's just slightly rounded on the bottom just to make it more comfortable. When you lie on an absolute flat surface, it's actually uncomfortable. But the way we've created this little arch here, it makes it much more comfortable. So there's an advanced controller here that allows you to control the top canopy, that's this part here, separate from the lower bed. And in the training, we go over why that's important. Also, you can fully customize the patient, the treatment based on how much power and what I told you before about frequency. So, and also what's really important is that this canopy on other devices doesn't work as well. On ours, the canopy comes really close to the body. And the reason why that's important is as you come away from the body with your lights, you lose power exponentially. You don't want that. You want the lights to come as close to the body as possible. One of our key competitors has a very high arcing dome. The lights are way off the body, and so the end results are basically ineffective. Our lights have been compared to a panini sandwich maker. And so it's open on the ends so that it allows for claustrophobics to not feel like it's a coffin. People describe this type of bed, which is all of the other beds are like this. They're like coffins to people. So not only that, but also the top canopy comes flush against the person's body. So it's really simple. The patient gets in the room. She removes her outer clothing, he or she. They press the power buttons on. They get in the bed. They get out of the bed. They get dressed and leave, and an assistant goes in there and wipes down the bed. So you don't need staff to help other than someone go in there and spend 30 seconds to just use a hand sanitizer to actually wipe down the bed. And of course, as I had mentioned before, we don't just give you a bed. We include business in a box. So there are many items that are included, including, of course, the shipping and installation. So we're not going to just drop the bed there. We're going to set it up in your facility. There's also the whole body vibration, the pop-up banner, lymphatic massager, the body comp analyzer, the marketing material, the personalized waiting room videos, the one-on-one trainings, both basic and business and advanced, the advanced business coach that we also include. And then, of course, we include the marketing. And that marketing success has to do with your region. We talk to the experts and find out what is the likelihood of being able to drive business to your facility. But if you have a facility that already has business, we're going to teach you how to take these people that are already seeing you for something else and get them to be so excited about this bed. And of course, the unlimited customer support that comes along with this. And I'm going to introduce you to my assistant, Brigitte, who's the executive of sales, and she will go over with you when you contact her, and I'll show you her contact information in a moment. You'll be able to talk to her about how this makes sense to incorporate into your practice and your business or whatever you have. You don't need a health practitioner's license, and I'm going to go over that in a minute. So the things that you should be looking at is, one, how many lights? Now, there are beds that talk about having more lights than us, but each one of their lights is like little mini lights. Our lights are extremely powerful, where they're high powered. Also, you want an integrated bed with red and near infrared at the same time. Also, you want the size of the bed. The reason why we have it with the basketball players, football players, and others is because our bed can accommodate someone 6'8". And if they're taller than that, we have a head extender, so we can go to 7 foot 8 inches. This is not a toy, so it does require high-end electronics, which is not difficult. We send you the outlet, and we hand you the instructions that you give to the electrician, and they set it up. As far as the FDA is concerned, it's fully registered internationally, actually. So in summary, you've got an effortless and healthy weight loss program, anti-aging facelift, a natural healing program. It's an all-cash business. You don't have to worry about insurance companies or attorneys. It's very easy and quick to administer. And as I mentioned before, it does not require a health practitioner's license because these beds are so safe. As I had mentioned, in 50 years of studying this technology, there's never been a recorded side effect and can help a huge percentage of the adult population. I would tell you that almost anybody that's over 40 years old will gain tremendous benefit of getting in the bed that you get. There's no known risks or side effects. The treatment is absolutely safe and non-invasive. And I'm telling you, if you're not currently offering this type of service in your business, you're working at a distinct disadvantage. If you know anything about the body, that includes the entire fitness industry, so med spas, day spas, the entire healing industry, weight loss industry, you should be using our bed. It's a great way to increase your income. It's a new client machine that will drive many more people to your facility, but also your current clients are going to rush to sign up for such a thing. These treatments take only 12 minutes, so you can see 3 people an hour quite easily. The return on investment, leasing is about $1,400, $1,400 to $1,600. It depends on your credit rating and other items, but the cost of lease is very inexpensive, relatively speaking, because the average package that our practitioners are selling are about $2,400. So just one new patient a month will more than pay for the bed. The average monthly gross that our practitioners are noticing now, excuse me, we're using dollars here. So whatever country you're in, just, you can figure out what this means. But our average facility is grossing between $10,000 and $20,000. So again, the number of lights, the power of the lights, the overall power of the bed, the number of wavelengths. We have 2 red and 2 near infrared, glorious wavelengths that don't have any chance of any damage or injury like UV. We don't have UV light or other colors that can get in the way. The treatment is completely customizable. The ability that you have to control the canopy and the bed separately, the number of fans required. And the reason why this is important is because some of the beds that are inferior need a lot of fans. Now you would think, well, what's the big deal? It's you've heard of high frequency EMF. This is something you want to stay away from. Our EMF in our bed is essentially negligible, but these beds that have high levels of fans, they have much higher rates of EMF that you want to stay away from. Of course, we talked about total light coverage, the distance of the canopy. You want that canopy right down onto the person's body. And this is my attitude. Brigitte, that I'm going to bring on in just a moment, actually, she made this for me. And it's just my attitude is, would you just get in the bed, try it for 6 visits, and if you don't see a difference, I would be very surprised. So here's my information. I'm going to bring Brigitte on right now. Hi there, Brigitte.
Well, hello. Thank you, Dr. Carl. That was a great presentation. So as you all can see, this is something that we're passionate about. We want to make sure that all of our providers are very well taken care of, that they are successful from day one. So we have a lot to provide. We have all the marketing tools, all that you need. We have a great digital brochure that has all this information, the key benefits, the specs, the links to Google Scholar, all the educational videos, YouTube channel, your return on investment. So there's a lot that we have covered, and there's a lot that we provide.
Well, thank you, Brigitte. So basically, there's a couple of ways of getting in touch with us. First of all, you can go to the website, trifectalight.com, go to the Contact Us page, and on the right side of that page, we'll give you some information that you might want to look at and determine if this is something that would be wise for you to incorporate in your business. And so one of the things is on the website, and you can put that, notice that, or you can send an email to Brigitte, which is right here, Brigitte at trifectalight.com, or you can call her either through WhatsApp. And Brigitte, you told me that you want people calling you at 4:00 in the morning, right? Okay, maybe not. But you can contact her via WhatsApp. She's on the West Coast of she's in California. So get an idea, if that's Pacific time. Or you can call her directly, if that's okay. Or would you rather them text you or call you, or what would you prefer?
It doesn't matter. They can call or text or email. Yeah. And if you go on the website, just make sure that you put my name, referred by who referred you. Just put put my name, then I know I'm gonna get back to you quickly.
Okay. So
Okay.
again, that's her phone number, that's her information. So now, are there questions that you guys have for us?
Hi there. What an interesting presentation. Thanks so much for sharing all of that. We do have some questions. Um, how often would it be typically recommended to use the light bed?
So it really depends on the issue and the condition, but by default, it's typically 3 times a week until we reach a goal.
Okay.
So, I mean, again, remember 48 years of as a chiropractor, tens of thousands of patients, and a very common question is, well, first of all, how many visits? And the answer is 3 times a week until we reach our target. That target might be handled in a month, but it might take longer. If you have severe issues or whatever, it could possibly take longer.
Thank you. And you mentioned the lights being as close to the skin as possible. Is there an optimal distance, or is right on the skin the ideal?
The optimal distance is as close as possible.
Okay. Another question is regarding eye improvement. Is that connected specifically to whole body light therapy, or is that something that is seen with more localized therapy?
I'm sorry, with what was that type of
With
therapy?
the improvement in the eyes?
What were the two choices? Red light therapy or what?
Whole body light therapy or just a localized treatment using light therapy?
Well, I deal with whole body no matter what.
Mm-hmm.
If somebody came in with an eye issue, an elbow issue, I'm treating the whole body. It's all intertwined. So you want to make sure that you have perfect blood flow, perfect nerve flow. And so we never saw these miracles when we just did localized. Like, I don't have an objection to the mask or a helmet or things like that. But if you want the full body exposure, or if you want the highest level of degree of success, you want full body coverage.
Great. And one other question is, why would you want the bed and canopy at different settings? You mentioned that was an ability of the machine. Why would you want them different?
Well, and power wise, some people weigh a lot and they're going to sink into the bed a little bit more. So they're going to be even more flush against the lights. With the top canopy, as it comes down, obviously there's no weight on that. So we might want to lower the bottom sometimes, raise the top. Now, on some people, I go through this in the training, but there were just 2 or 3, not major reasons, but there are some important reasons, I should say, of why we might want to control them separately. And I go over that in the advanced training.
Brilliant, thanks. And what kind of maintenance or care do the beds require?
Oh, that's a great question. So, in a word, none. The bulk and the essence of that bed is slated to last 5 years. The wear and tear is mostly on the outside. If you can see I don't know if you can see the bed. It's really small here as I'm sharing the screen, but there are hydraulics on either side. Every time you open it and close it, it doesn't come slamming down as these other beds will seal. It comes down with the help of these hydraulic arms. So you can bring it as close to your body or take it off. If you want to get out of the bed, you push it up very lightly. And those hydraulics have a 2-year shelf life or life. Well, we include 2 sets. But if they go out, then we replace them. And it's a pretty simple fix.
Great, thank you.
Other than that, the lights and the bed itself are slated to last a minimum of 5 years.
Great. And you mentioned the rental price for the bed. Would that be the same for a client in Mexico, Caribbean, or Latin America?
But that's not rental. Those are lease payments.
Lease payments.
And a lease means, but a medical lease, I don't know with outside of the United States. I'm not as familiar with so you would contact your bank or you'd contact one of our, places, and they can go over some of the details if it's outside of the country.
And what would be the total cost in US dollars of the bed?
Brigitte, what are the total costs?
So it's 69,995. And so with the leasing, not the financing options, I mean, depending, some people want to put something down. It depends on a few factors, the credit and so on, but it comes down to about, 1,400 a month. And also now we decided that we're going to offer your group $5,000 off until the end of October. So that's a good price. And then we're, going to help you, all your members to get, off the ground and be very successful.
Great. We can add that into the comments for the webinar. That is all of the questions. Thank you so much for sharing this information.
You're welcome. You're welcome. So contact me and I can answer all your questions and I'd be happy to help.
Perfect. Thank you, Dr. Carl.
My
Okay.
pleasure. You guys take care, all right?
Bye-bye. Bye-bye.